All right. Hi, I'm Chaley Zachmeyer.
Hello, Miss Ackmeyer. Welcome.
It's really nice to meet you. Thank you so much for the opportunity to interview today.
Well, we're glad to have you here for this interview. So I'm just going to ask you a few questions. We'll try to have some fun with this, and we'll see how it goes. So, first question: why do you want to work at this medical facility?
I would like to start my career as a new nurse here because I've heard a lot of good things about this hospital, and I would like to start my career in a hospital because I think that a it will be good for me to continue to improve my patient care and continue my exposure to different pathophysiology and patient issues, work on time management, prioritization, and keep my skills fresh in a fast paced environment. And I think that while um, I really like how in nursing you can take your career in a lot of different directions, I think that for me, it's a good fit to start in a hospital and be able to build on the skills that I've started to work on in clinicals and during nursing school. And as far as this particular hospital, after reviewing your mission statement of providing excellent patient care and education to each patient, that really aligns with my own personal philosophy of nursing and where I want to take my career. So I think that we would be a really good fit for each other.
Well, I'm glad that you like how our hospital runs and the benefits that we provide. But what uh, what benefits would you bring to our organization by you beginning working with us?
Well, I'm a really hard worker, so I would come to work every day prepared to give it my all and work as hard as I could to help each patient. I'm a strong communicator, which is a skill that I've worked on during my many years as a flight attendant and a waitress. I've had so many different interactions with lots of different people that it's really helped me to be a good communicator. And I would use that skill to uh, effectively facilitate everything that each patient needed among the healthcare team. And also, I strive to always have a positive attitude and be a friendly person to everyone. And I think having an upbeat personality and being friendly really goes a long way as far as being a good member of the team.
Okay, so let's talk about some of your personal strengths and weaknesses.
Okay. Well, for a strength, um, I definitely would say one of them is that I'm very determined. And if I set my mind to doing something, I make sure that it happens. I do whatever I need to do to figure out how to make it happen. And I've brought that tenacity to a lot of different parts of my life, including getting into and being successful in nursing school, my career as a flight attendant, um, making sure that I honor commitments to friends and family, and also ensuring that I was a contestant on the Price is Right game show, which is a funny story. Um, and for weaknesses, I think that's always more challenging. But for me, one that sticks out is that I can be pretty hard on myself. And that might show up as getting a question incorrect on an exam that I really knew the answer to, or talking to somebody and having something that I say come out a little bit wrong, and then reflecting on the situation and kind of beating myself up about it. But because I have been aware of this weakness of mine, I have been working on it. And I've been trying to do a better job at recognizing when I'm doing that. And instead of continuing to beat myself up, just thinking about how I could have done something differently or what I've learned from the situation and how I'm going to be a little bit happier with my decision or what I said or whatever the situation is the next time. And then I try to let it go. And it doesn't always work, of course. It's something I'm still working on, but um, I do feel like I've gotten a bit better with it. So that's
That's
good.
great. So, where do you see yourself in 5 or maybe 10 years?
Hmm. 10 years I think is tricky because I wouldn't have ever thought that I would be a nurse 10 years ago. And I'm really excited to be starting my career as a nurse. But I don't know, other than being a nurse, where I'll be in 10 years. But 5 years I feel like is a little bit easier to think ahead to, because I can frame that with how I feel as a new nurse right now, which is coming out of school. I feel like I've learned a lot, and at the same time, I feel like I have a lot more to learn. And sometimes I worry if I know enough to be a good new nurse. But I've realized, after talking with a lot of nurses on the floor in clinicals and friends of mine who are nurses, that a lot of people feel this way as new nurses, and it's normal. And it takes a few years to feel like you really feel like you know how to be a nurse. And so I would hope that in 5 years, I feel a bit more confident and competent in providing good nursing care, and that I'm happy in this position. And I am really excited to become a nurse. And so I see myself as being happy.
Well, unfortunately, in this line of work, not everything is happy. We have conflicts that arise from time to time. Can you tell us about a time that you had a conflict with maybe a coworker or an employer, patient, or maybe even a family member, and how you might have resolved that?
Sure. When I think about different conflicts that I've had um, in my life, I feel like a lot of them come from a miscommunication or a lack of information, um, from one party or the other. So when I think about resolving these conflicts, I think about how I do that with good communication. Um, Luckily, I'm the type of person that isn't afraid to bring up something that is can be uncomfortable. So I'm pretty good at broaching the topic if there's a conflict that needs to be discussed. And I use that ability to be confrontational in a constructive way, by trying to be to the point, but also caring and thoughtful of the other person, and allow them the space to say what they need to, so that we can have a good discussion about it. Um, and hopefully in doing so, be able to come to some sort of an understanding, or a change in roles, a change in plan, so that we can prevent conflict in the future. um, I feel like I can use that sort of description for how I've resolved conflict a lot in my job as a waitress, because that is definitely a job where customer service is really important. And um, you have customers that are upset about their meal being cold, about them not getting something that they asked for, or just not being happy with their experience. And I think, just like with being a nurse, if you're resolving a conflict like that, um, you need to assess what really that person is upset about, and what they need in order to feel better about it. And you need to allow that person uh, the space, again, to communicate what their wants, what their desires are, um, while structuring the conversation to try to come to a good end point. And then do your best to try to provide the customer um, with something that will make them feel better, or at least sometimes it's enough for them to have told you that they weren't happy. And yeah, just so they were able to voice that. So I can see some parallels with nursing and waitressing in that regard.
Okay. So, in addition to conflict, there are often many events that happen around here. Maybe you could share with us one of your most memorable experiences with one of your clients, or maybe a family member.
Sure. There are so many different patient interactions that I've had during nursing school that have meant a lot to me. But there is one in particular that I will always remember, and it was a really nice memory. I had a patient that I was caring for that was under the impression that he was going to be discharged, and then we got some lab results, and the doctor changed the plan, and the patient was going to have to stay in the hospital longer. And the patient was so disappointed and upset. And I asked him if there was anything that I could do to make it better, that I couldn't change the fact that he had to stay in the hospital longer, but was there anything that I could do to make his day a little bit brighter? And he was reluctant to share anything with me. But I reminded him again that I really would like the chance to make his day better. And he told me that even though it maybe was silly, that the thing that he was really looking forward to was his granddaughter bringing him a Starbucks Frappuccino. So I said that I could try to see if that could happen for him still. And he seemed a little bit more upset to admit that he didn't have his wallet with him because his wife had taken it home with his other belongings. So I said I would see what I could do, and I left the room, and I checked in with the primary nurse and checked to make sure that there was no dietary conflict with him having something from Starbucks. And I checked in with my clinical instructor to see if it was appropriate for me to go and get him a Starbucks drink. And she said that it was, so I ran down and I got one. And when I brought it back, his face lit up and he had tears in his eyes. And it was so nice to make his day a little bit better. And I realized when that happened that I wasn't going to be able to do that for every patient, but for me in that situation, it seemed like an easy thing to be able to make happen for him, and I was so happy that I could do that because I think it was great for both of us to have his day be a little bit better. Mine was too.
That's nice. How do you manage your time in stressful situations?
So as far as managing my time, I'm a really organized person, and I try to think ahead to what needs to get done. I make lists, I revise those lists. I'm not a procrastinator, so I try to get things done in a timely manner as quickly as I can. As far as being in stressful situations and how I get through those, um, I I like to, when I'm in a stressful situation, think about how that situation is not going to last forever, that there will be an end to it. And whatever anxiety or discomfort that I'm feeling from that situation, that's not going to be forever. And so that's helpful for me in getting through. Um, and another strategy on a larger scale, with that same example that's helped me is during nursing school, there are times when I feel completely overwhelmed with assignments and studies and things to take in. And I feel sometimes like there's no way that I can possibly get it all done. But then I remind myself at this point in school that I've done one semester, two, three, and I'm going to be able to do another one, even though sometimes it doesn't feel like it. So I think almost psyching myself out and reminding myself that I can do it is one way that I deal with stress, and then just that organizational piece.
Okay, thank you. What questions might you have for us?
Well, I'm curious about what feedback nurses who work in this hospital have, both positive and negative, about working here. And I'm also curious what you would suggest is important for a new nurse to know with working in this hospital.
Okay, well, I will take that into consideration and we'll get back to you on that. My supervisor will look that over and talk to you about that. So let's talk about a situation that you may experience here and how you might handle it. So let's say you have a client that is returning from surgery, status post-repair of a bowel obstruction. His BP is 90/50. His respiratory rate is 28. His heart rate is 113. Sats are 97 on 2 liters of NC. What would your priority be with this client? And then explain to me the process of caring for this client immediately post-op.
Okay. Well, for me, the thing that stands out the most with those vitals is the low blood pressure and the high heart rate as well. So considering that they are immediately post-op, there's a possibility that they could be bleeding. And so that would be a major priority for me. I'd want to be checking their incision and their flank area to make sure that they didn't have any blood pooling behind them. I'd want to do a thorough full body assessment to just make sure that there was no indication of bleeding. However, I would also remember that there could be internal bleeding. And so depending on how my interventions and assessments went, I might want to contact the doctor about getting a CT scan to check for internal bleeding or other issues that could have happened from the surgery. Another priority with that low blood pressure, if the patient wasn't bleeding, would be to make sure that they were continuing to receive IV fluids. So I'd want to make sure that they were receiving a high enough rate of IV fluids to hopefully make an impact on that blood pressure. And I could do a passive leg maneuver to see if the fluids were helping. And that could help me determine if I should carry on with the fluids, and that was helping the blood pressure stabilize, or if there was the need for vasopressors. I'd want to continue to monitor the vitals, especially the blood pressure, make sure that the patient continued to be able to maintain their airway, monitor what the level of consciousness was for the patient, as well as any changes, pain management, if they were urinating, since I would be aware of the possibility of them going into shock with that low blood pressure. So depending on how all of those assessments and interventions went and what this patient's status was, then I would determine from there if I needed to contact the provider or not.
Okay, thank you. Finally, I would like you to explain to me what your understanding of sepsis is.
Okay, sure. So sepsis is a distributive vasodilation of the vasculature that is brought on by a systemic infection. And so because the veins, because the vasculature is so vasodilated, it's going to cause a drop in blood pressure. And that in turn is going to mean that the patient isn't perfusing properly. In sepsis, the interesting thing is because of that vasodilation, you're still going to have a high cardiac output. So at least initially, you're not going to have a patient who is cool, pale, diaphoretic in the same way that they would be in a different shock state. But if it's not addressed, then those signs and symptoms will appear. So for that reason, it's really important to be aware of the SIRS criteria and Q-SOFA in order to really recognize changes in vitals, labs, patient mentition early on so that you can recognize what is going on, and also to be aware of different risk factors that could heighten the patient's risk for going into sepsis, such as trauma or a UTI or a myocardial infarction. And so using all of your knowledge to be able to assess a patient and be able to determine if they are going down the path to sepsis and to stop it before it goes into septic shock and MODS. The other part of sepsis that's important is to make sure that you're giving IV bolus fluids, that you get a culture as soon as possible so that you can determine what the pathogen is. And then you're also going to be giving antibiotics. So in a nutshell, that's some information about my understanding of sepsis for you.
Okay. Well, thank you very much for your time, Ms. Ekmeyer. We'll give you a call.
Okay, thank you so much. It's been a pleasure.
Yeah, have a nice day.
All right, you too.